The Intensive Care Unit, ICU, also known as the Critical Care Unit or Intensive Therapy Unit, is a specialized area within a hospital designed to provide intensive medical care to patients with life-threatening illnesses or injuries. Here's an overview of what the ICU environment is like. Highly specialized care. The ICU is staffed with a team of highly trained healthcare professionals, including critical care nurses, intensivists, doctors specializing in critical care, respiratory therapists, and other specialists. They work together to provide round-the-clock care to patients with severe medical conditions. Advanced monitoring. ICU patients are typically connected to a range of advanced monitoring equipment. This includes continuous ECG, electrocardiogram monitoring, blood pressure monitoring, pulse oximetry, to measure oxygen levels in the blood, and invasive monitors like arterial lines and central venous catheters. This constant monitoring allows healthcare providers to closely track a patient's vital signs and make rapid interventions when necessary. Life support systems. Many ICU patients require life support systems such as mechanical ventilation, breathing machines, dialysis machines for kidney support, and intravenous medications to maintain their vital functions. These machines are closely monitored and adjusted as needed by the medical team. Limited visitation. Due to the critical nature of the patient's conditions and the need to maintain a sterile and controlled environment, ICUs often have strict visitation policies. Family members and loved ones may have limited access and are usually required to follow specific guidelines to minimize the risk of infection and disruption to patient care. Constant surveillance. Nurses and other healthcare providers in the ICU are vigilant and attentive to changes in a patient's condition. They perform frequent assessments, administer medications, and adjust treatments as needed. This level of care requires excellent teamwork and communication among the healthcare team members. Noise and activity. ICUs can be bustling and noisy places, with alarms from monitoring equipment, conversations among staff, and medical equipment in use. Despite the activity, the focus is always on providing the best possible care to the patient. Emotional and psychological support. Patients in the ICU often face life-threatening situations, which can be emotionally and psychologically challenging for both patients and their families. Healthcare providers in the ICU not only attend to physical needs but also provide emotional support and communicate with families to keep them informed about the patient's condition and progress. Specialized units. Some ICUs are designed for specific types of patients, such as surgical ICUs for post-operative care, cardiac ICUs for heart-related conditions, and neonatal ICUs for critically ill newborns. Each type of ICU has its own unique equipment and specialized care protocols. Challenging and rewarding. Working in the ICU can be emotionally demanding and physically challenging for healthcare professionals, but it can also be incredibly rewarding. Saving lives and providing critical care to those in need are the primary goals of the ICU environment. In summary, the ICU is a specialized and highly controlled medical environment where critically ill patients receive intensive care and monitoring from a dedicated team of healthcare professionals. It is a place where teamwork, expertise, and constant vigilance are essential to provide the best possible care to patients facing life-threatening conditions.